Hi there, and welcome to Dr. Victoria Brooks' channel, a friendly space where we talk openly about men's health, vitality, and confidence after 50. Let me start with a simple but surprising question. Could the one part of your body you almost never think about be quietly shaping your energy, your intimacy, and your future? Most men over 50 carefully watch their heart, blood pressure, and digestion, but often overlook another area that deserves just as much care. I'm talking about your penis. Many believe that if there's no pain, there's nothing to worry about. But the truth is, neglect over time can chip away at your performance, your confidence, and even your overall health. The good news? There's a simple routine, what I call essential penis care, that any man over 50 can begin right now. It's quick, it's inexpensive, and it's surprisingly easy. By following it, you can dramatically improve how you feel, how you function, and how confident you are in your own skin. Stick with me until the end of this video, because I'm going to walk you through each step, and by the end, you'll know exactly how to protect your health, your intimacy, and your confidence. Let's start with the foundation, circulation. Healthy blood flow is the lifeline of sexual performance, and after 50, circulation naturally begins to slow. Left unchecked, that slowdown can lead to loss of firmness, stamina, and sensitivity. Daily movement. Even something as simple as a brisk walk helps keep the blood vessels that supply your penis flexible and strong. Think of it like watering a garden. Steady flow, thriving plants, dried up flow, weakening roots. Movement is your first step, because your penis cannot perform at its best if your circulation is neglected. Next comes hygiene. Many men dismiss hygiene as routine, but in truth it plays a major role in long-term penile health. Gentle daily cleaning with warm water, especially under the foreskin if you're uncircumcised, minimizes bacterial buildup and prevents irritation. Poor hygiene can lead to odor, infection, and inflammation that can make intimacy uncomfortable. Treat hygiene as non-negotiable, and you protect not only your health but also your confidence. The third step is hydration, something most men completely overlook. Just as your skin becomes drier and less elastic with age, the tissues of your penis can lose flexibility when you're chronically dehydrated. This affects comfort, sensitivity, and even your ability to stay firm. Drinking enough water each day isn't only good for your kidneys or your heart. It directly supports the smooth function of your sexual organs. Follow these 3 steps, circulation, hygiene, and hydration, and you'll create a powerful foundation for stronger performance, better health, and renewed confidence. If you want your body to perform for you, you must give it the hydration it needs. Water is the simplest and most overlooked foundation of sexual health. Without it, your tissues lose elasticity, your blood thickens, and circulation slows. Nutrition is the next pillar of care. Every bite you take is either supporting blood flow or restricting it. Diets loaded with processed fats, sugars, and salt harden arteries and choke the circulation your penis depends on. By contrast, a plate filled with leafy greens, fatty fish, nuts, seeds, and berries supplies the nutrients that keep blood vessels open and hormones steady. Each meal becomes a quiet vote for or against your vitality. This is why nutrition belongs at the center of your care routine. Now let's talk about rest and recovery. After 50, your body needs deeper, more consistent rest to replenish testosterone and repair tissues. Poor sleep is a hidden enemy of performance, quietly draining the hormones that drive desire and firmness. Treating sleep as optional is like trying to drive a car without fuel. Make it a priority. It's not a luxury. It's a medical necessity for your sexual health. Think of sleep as your private repair shop, restoring your energy so you're ready to function fully again. Stress management is another overlooked key. Chronic stress floods your system with cortisol, a hormone that blocks testosterone and constricts blood flow. Left unchecked, stress shrinks desire, weakens erections, and turns intimacy into a chore. Simple daily practices, meditation, slow breathing, or setting aside quiet time, can reduce cortisol and rebalance your system. Lower stress equals stronger performance and a healthier prostate. The next step is checking in with your prostate. Many men over 50 don't realize how closely the prostate and penis are connected. An enlarged or irritated prostate can press on the urethra and disrupt both urinary and sexual function. Regular checkups, screenings, and open conversations with your doctor form the backbone of essential care. Preventive attention isn't about fear. It's about protecting your ability to enjoy life fully without setbacks. Let's also cover safe intimacy, using protection when necessary, choosing skin-friendly lubricants, and approaching intimacy with patience all safeguard your long-term health. As tissues become more delicate with age, a little extra care goes a long way. Proper lubrication during intimacy or self-pleasure reduces strain and prevents small injuries from becoming bigger problems. Safe, comfortable intimacy isn't only about avoiding infection. It's about ensuring your experiences remain enjoyable and pain-free. Finally, let's discuss awareness, your most powerful tool. Pay attention to shifts in firmness, sensitivity, or comfort. Your body is always sending signals. Noticing them early lets you act before small changes become major issues. When you bring hydration, nutrition, rest, stress control, prostate care, safe intimacy, and awareness together, you create a foundation for lasting performance, confidence, and vitality at any age. Pay close attention to your body's signals. If you notice new pain, swelling, or any change in urination, don't brush it off. These aren't inconveniences. They're your body's way of asking for help. Acting early is almost always simpler, safer, and more effective than waiting until an issue grows into something serious. So what does the essential penis care routine really look like for men over 50? It's a clear, practical plan built around circulation, hygiene, hydration, nutrition, rest, stress management, prostate health, safe intimacy, and daily self-awareness. Together, these steps create a full body routine that safeguards not just your penis, but also your energy, your confidence, and your overall quality of life. I want you to remember something important. Caring for your penis is not vanity. It's not something to hide or feel embarrassed about. It's a vital piece of caring for your health as a whole man. When you give this part of your body the attention it deserves, it rewards you with strength, comfort, and confidence at any age. I'm Dr. Victoria Brooks, and I'm so glad you spent this time with me. If you found this conversation useful, subscribe to the channel for more clear, science-backed advice on men's health after 50. Take care of your body. You only get one, and it deserves your respect.